Hi, welcome. I wanted to thank you for checking out this video on using cold laser and non-conventional therapies for correcting knee pain problems. Knee pain is a very common problem. It affects millions of Americans every year. And whenever somebody has a knee pain issue, the natural thing for people to want to do is to reach for an over-the-counter medication or go to a surgeon. We live in a drug culture, and because of that, we're inclined to go to reach for an over-the-counter medication first, something like Tylenol or ibuprofen or Aleve or something like that. And when that doesn't fix the problem, the next stage is to go to a your medical doctor for something stronger. And then when that doesn't fix the problem, then you go get a referral to physical therapy and then eventually to an orthopedic surgeon. So before I go into a little bit more detail about how we could correct chronic knee issues, I want to start off by just going over the knee anatomy first. So I want to make sure that this actually shows up on the computer. Sometimes you have a problem with it showing up on my green screen. So the knee joint is consisting of three or four basic bones. You have the bone right here called the tibia. This is the bone in your shin. And then you have the bone up in here. This is called the femur. That's your thigh bone. You have a bone that sits right in the front here called the patella. That's your kneecap. And then this little bone right in here, that's actually called the fibula, but it's not part of the knee joint proper. It's just for the attachment of muscles. So in between these two big bones right here, you've got some soft tissues. You've got this one soft tissue that spans across the whole knee joint, and that's called the meniscus. And the meniscus kind of acts as a shock absorber or a protector, and that protects the bones from rubbing into each other. Then you have this blue stuff right here, and that's called the articular cartilage. The articular cartilage is kind of like if you ever clean a chicken and you see that white shiny stuff at the end of the long bones. That's the same thing, and that protects the bones again from rubbing into each other and protects against friction. On this side right here, you've got the lateral collateral ligament, and on this side, you have the medial collateral ligament, and those prevent side to side shifting. If you ever watch a football game and you see a running back get tackled by a safety or like a wideout, sometimes they'll crash into the knee joint and they'll tear up the knee, and that's these two ligaments getting wrecked. On the back of the knee, you can see that there's the meniscus that runs the length of the knee joint. And then you see the posterior collateral ligament and the anterior collateral ligament, or the ACL. And then you see again, the articular cartilage. So there's a lot of moving pieces and parts in the knee joint. By the way, this is what your knee looked like when you're about 25 years old, and there's no signs of arthritis or degeneration going on yet. This knee is what your knee looks like when you're approaching the sixth and seventh and eighth decades of life. You can see that the bone is starting to become kind of arthritic, has this weird appearance, this ungainly appearance. Then you see the ulcers that are appearing in the articular cartilage. But what's interesting is that the meniscus is getting really thin. It's getting really worn down. And if you compare that to a healthy joint, you can see very clearly the difference in the thickness between these two types of meniscus. The person that has this type of a knee, they often say, well, I've got bone on bone. It's very rare that somebody actually has bone on bone. If you have bone on bone, you would not be able to bend or flex your knee joint whatsoever. You'd actually be in the emergency room and an emergency orthopedic crisis where you need absolute surgery right away. Even though most people say they are bone on bone, they actually don't have bone on bone. There's actually a little bit of tissue, and the meniscus right here, and there's something that we can do about it. So getting back to the topic of our conversation, what can you do to alleviate knee pain, improve mobility, get everything functioning better, but without drugs, without surgery, without injections, and without cutting something out of the knee joint? In my office, we use a therapy called cold laser. And laser therapy uses a process called photobiostimulation. Photo meaning light, bio meaning living tissue, and stimulation meaning that if it affects the living tissues. So, what laser therapy technically does is it affects the mitochondria, the powerhouse of the cells, and it accelerates healing. It turns on the warmth that your body needs to heal and repair, and it accelerates the recovery of the soft tissues. The knee joint actually has six muscles on the front of the knee joint and six muscles in the back of the knee joint. And those muscles need to be working correctly, or you're not going to have good mechanics. And if you don't have good mechanics, it not only causes pain, it causes abnormal movement, restricted ranges of motion, and other types of problems. Now, what do the treatments feel like when you have laser therapy on your knees? During a cold laser session, a special handheld device is placed on the knee joint, and you won't feel anything, but that's either hot or painful. Some people may feel a little bit of gentle warmth or mild tingling, but many feel nothing at all. And each session is going to last between 8 to 15 minutes. After a few treatments, the people notice less pain overall, better movement, and more comfort during heavy stress. And one of the other questions we have is, well, how many treatments are you actually going to need? Every knee is a little bit different. Every knee brings about a different story, different amounts of damage, and so they could range from maybe 5 sessions up to 15 sessions. It depends on what you bring to the party. So there's no way of determining exactly how many treatments that you're going to need at the very beginning without me doing a proper, thorough examination. So, in conclusion, knees are extremely beneficial for cold laser therapy. It benefits the soft tissues, it benefits the hard tissues. And my recommendation is to come on in, get your knees evaluated if you've got knee pain problems, and let's find out if you're a great candidate for laser therapy for your knees. Thank you very much for watching. The best way to support this channel is to hit the like, subscribe, and the notification button so that you'll be alerted of when new content is being released. Thank you very much for watching. If you have any questions, please feel free to visit us on the web at chronicpa.com. This is Dr. Kevin Smith. Thank you very much for watching.